This is the third of 5 Quality Talk episodes that looks at the American Heart Association's Get With the Guidelines Stroke Program and Registry. Hi, I'm Jody Jackson. I'm the host of Quality Talk. Quality Talk is a podcast from Primaris Healthcare, focusing on healthcare quality improvement with an emphasis on the value-based care reimbursement demands facing health systems, practices, and clinicians. Quality Talk occasionally also delves into the topics of social determinants of health, patient safety, and a plethora of other related topics, as well as talking to the newsmakers and leaders in the healthcare industry. So thanks again for listening and for joining me. We're going to do a brief episode here looking at Get With the Guidelines Stroke abstraction with questions and answers from the field. We asked the quality data services team at Primaris to list some of the common questions that they hear from facilities and from practices that are wondering about Get With the Guidelines Stroke abstraction and how to participate in the registry and those sorts of things. So the first question is, what are the benefits of participating in this registry? And the answer that we receive from our own subject matter experts is simply achieving improved patient outcomes is the great benefit of this registry. There's also the ability to collaborate with the Joint Commission programs for accreditation and certification. You know, the Joint Commission is the organization that accredits stroke centers. So if you're a certified stroke center that's coming through a recognition and achievement from the Joint Commission. And we've mentioned in the previous episodes that you can be a certified stroke center and not be part of Get With the Guidelines Stroke, but there are additional benefits, especially when it comes to public reputation, and if you're recruiting other physicians. There's a huge benefit by also being involved with the Get With the Guidelines Stroke registry. Publicly reported data is another important distinction and a benefit of participating in this registry. Having access to hospital and industry-wide recognition programs. Plus, there is the branded endorsement by the American Heart Association. The AHA has a Know Before You Go network of stroke centers. And we will provide a link to that particular benefit on our website with the show notes for this episode. A couple of other benefits of participating in Get With the Guidelines Stroke: proven patient education materials provided by the AHA. Get With the Guidelines Stroke does quite a bit of patient-facing patient education programs. Also provides clinical tools for stroke teams, plus workshops and webinars. And you can also participate and benefit from current research based on the data reported. And that should ultimately improve the quality of care and hopefully by extension lower the cost of that care. So you want to know, how do I get started? Well, the guidelines and overview are provided at the website at www. I said too many W's there. 3Ws.heart.org. And you can look when you get to that website, you search for the Get With the Guidelines Stroke Overview, and there are some guidelines and a video there. That link will be available with the show notes for this episode. So look for those on our website. Or if you subscribe to Quality Talk, you're going to get that with your email that has this episode. You can also reach out to your local representative at GWTGA Awards. Wait a minute. Let me say that again. GWTG Awards at heart.org. So it's the initials GWTG, then the word awards. That's all together. GWTG Awards at heart.org. The next question is, can Get With The Guidelines integrate with my current abstraction software? The answer is maybe. Get With The Guidelines has cooperative agreements with several software vendors, and the Primaris Quality Data Services team has the ability to integrate with and to access hundreds of different electronic health record systems. So let Primaris help guide you through that process of integrating your data for multiple registries and finding the most appropriate solution for your organization. As we look at other questions relating to this, I want to remind you to send questions you have, observations and feedback, or suggestions for future episodes of Quality Talk. You can send those to me at my Primaris email address, which is jjackson@primaris.org. That's the letter J, Jackson@primaris.org. So another question here is, what is the patient management tool? Now, this is software specifically for Get With The Guidelines. It is a Get With The Guidelines proprietary tool. So just kind of a style note here. When you think of Get With The Guidelines, you see the little registered circle mark there because Get With The Guidelines is registered. It's protected branding title. And so is patient management tool. It's capitalized because that is the proprietary tool, and it is also a registered mark. The patient management tool guides the user through abstracting the chart data to answer several different metrics, including IV RTPA, arrive by 2 hour, treat by 3 hour, early antithrombotics, VTE prophylaxis, anticoagulation for AFib or aflutter, smoking cessation, and statin prescribed discharge. So the Get With The Guidelines patient management tool is extremely helpful with helping you track, document, and report those measures. Now, let's say that your stroke team is comprised of clinicians with full-time duties. And this is certainly maybe not universal, but close to it, because we hear this from our clients who go from the East Coast of Boston and New York to all the way to the West Coast and everywhere in between, all across the country. We hear repeatedly from ACOs, from clinicians, from health systems. You know, the people that we have doing our abstraction are frontline healthcare workers. They have full-time duties. So how do we do this? How do you Get With The Guidelines stroke? Well, really, our quick answer for that is let Primaris help. We can abstract the data straight from your EMR and return you with actionable data about your biggest opportunities in your quality improvement journey. For instance, we can provide case-by-case reports with your opportunities for improvement, your OFIs, so you can determine, for example, if your priorities are last well-known documentation. We've already mentioned how that's a kind of a tricky measure to document. Are your priorities transfer times, or is it documenting the etiology of the stroke? Final question we'll look at here, what are a common pitfall? What is a common pitfall of trying to do this ourselves? Where are we likely to hit a snag? And this, again, involves last well known. There are myriad ways that last well known can be documented, as well as correctly classifying and abstracting the history of the stroke. It's also vital to abstract the stroke timeline to exact specifications. So there might be different ways of classifying it. There are limited number of ways to document it correctly and exactly. So if you still have questions, please contact Primaris today to learn more about how Primaris can help relieve the burden of your quality reporting processes. That's all for this episode. Thank you for joining me. Remember, I'm Jody Jackson Jr., your host, I'm going to repeat my offer to contact me with your questions, your comments, suggestions for future episodes at jjackson@primaris.org. You can also find the show notes for this episode with links to citations and other resources on our website at www.primaris.org. That's all for now, and thanks again for listening. Remember, Primaris is your partner in healthcare quality.